Hello everyone. Welcome to our discussion for today. What you need to learn. Lesson 1. Physical fitness is the ability of an individual to carry out daily tasks without undue fatigue. We need regular exercise and physical activity to promote strong muscles and bones to do all our daily activity. Physical fitness test objectives. 1. To determine the level of fitness of students. 2. Identify strength and weakness for development and improvement. 3. To provide baseline data for selection of physical activities for enhancement of health and skill performance. 4. To gather data for the development of norms and standards. 5. To motivate, guide SND. Counsel pupils students in selecting sports for recreation, competition and lifetime participation. Physical fitness have two categories: health-related fitness and skills-related fitness. The health-related fitness refer to those physical attributes which enable a person to cope with the requirements of daily living. Cardiovascular endurance, muscular strength, flexibility and body mass index, while skills-related are physical abilities that show potential for good performance in certain skills like speed, agility, reaction, time, balance and coordination. Health-related fitness. Body composition is the body's relative amount of fat to fat-free mass. Our bodies includes fat, protein, minerals and body water. Body mass index or BMI includes weight, the heaviness and lightness of a person, while height, the distance between the feet on the floor to the top of the head and standing position. For computing the body mass index we need weight in kilograms divide height in meters squared. The following classification of BMI: if below 18.5 a person is considered underweight, 18.5 to 24.9 a person is considered normal, 25 to 29.9 a person is considered overweight, and last 30 and above a person is obese. Cardiovascular endurance is the ability of the heart, lungs and blood vessels to deliver oxygen to working muscles and tissues in the body. Endurance may also refer to the ability of the muscle to do repeated work without fatigue. Physical fitness test example is 3-minute step test to measure cardiovascular endurance. Strength refers to the muscle's ability to generate force against physical objects. Physical fitness test example are 90-degree push-up to measure strength of upper extremities like triceps, lower back and shoulders, while basic planks to measure strength and stability of the core muscles. It replaces the curl-up. Flexibility refers to the ability of the joints to move through a full range of motion, like stretching. Physical fitness test example are sit and reach, a test of flexibility for lower extremities, particularly the hamstring, and zipper test, a test of upper arm and shoulder girdle flexibility intended to parallel the strength and endurance assessment of the region. Skill-related fitness. Speed: it is the ability to perform a movement in one direction in the shortest period of time. Physical fitness test example is 40-meter sprint to measure the running speed. Power: it is the ability of the muscle to release maximum force and transfer energy at a fast rate. Physical fitness test example is standing long jump to measure the explosive strength and power of the leg muscles. Agility: it is the ability to move in different directions quickly. Physical fitness test example is hexagon agility test to measure the ability of the body to move in different directions quickly. Reaction time: the amount of time it takes to respond to a stimulus. Physical fitness test example is stick drop test to measure the time to a stimulus. Coordination: the ability to use the senses with the body parts to perform motor skills smoothly and accurately. Physical fitness test example is juggling to measure the coordination of the eye and hand. Balance is the maintenance of equilibrium while stationary or moving. Physical fitness test example is stork balance stand test to assess one's ability to maintain equilibrium. To find out if you learned something to our lesson for today, answer the activity number 1. Title: Fitness analysis. Analyze the following activities. Write if it is health-related fitness or HRF, or skills-related fitness or SRF, and identify where it belongs. answer the activity number 2 title word search. Find the words related to the components of physical fitness in the word search below.
Hello everyone, welcome to our discussion for today. First aid is an immediate and temporary care given to a person who has been injured or suddenly taken ill. What are the objectives of first aid? To alleviate suffering, to prevent added injury or danger, and last, to prolong life. Characteristics of a good first aid are 1. Gentle means it does not cause pain and panic. A person must have a tender nature to the patient. 2. Observant, notice all signs, be aware to the status of the patient. 3. Resourceful, makes the best use of things at hand. They are able to think creatively. 4. Tactful, does not frighten the victim. He must be sensitive and respecting a person's feelings. 5. Sympathetic, comforts and reassures the victim. It pertains to a special affinity or mutual relationship. Common injury encountered by officiating officials and athletes. Sprain is caused by torn fibers in a ligament. Swelling and bruising are some signs and symptoms. The ligament can have a partial tear, or it can be completely torn apart. Ankle sprains are the most common type of sprain. Heat exhaustion is a response to heat characterized by fatigue, weakness, and collapse due to inadequate intake of water to compensate for loss of fluids during sweating. Other serious injuries that require immediate care or first aid include sprain versus strain. Sprain is a stretch or tear of a ligament, the band of connective tissues that joins the end of one bone with another. Strain is a twist or pull and tear of a muscle or tendon, a cord of tissue connecting muscle to bone. Knee injuries is the most commonly injured joint and can result from a blow or twist to the knee, from improper landing after a jump, or from running too hard, too much, or without proper warm-up. Fractures is a break in the bone that can occur from either a quick one-time injury to the bone, acute fracture, or from repeated stress to the bone over time, or stress fracture. Dislocations, when the two bones that come together to form a joint become separated, the joint is described as being dislocated. For example, the top of your arm bone fits into a joint at your shoulder. When it slips or pops out of that joint, you have a dislocated shoulder. You can dislocate almost any joint in your body, including your knee, hip, ankle, or shoulder. RICE method. Rest. The injured part, especially for the first 24 to 48 hours after the injury, this is the most critical time of treatment. Avoid any activity that causes pain or makes it worse. Use crutches if the leg, foot, or ankle is injured. Support an injured wrist, arm, or shoulder with a sling. Tape an injured toe or finger to its healthy neighbor. Ice is an excellent anti-inflammatory and reduces swelling and pain. Apply an ice pack or cold compress for 10 to 15 minutes as soon as possible after an injury. Repeat each hour for the first 3 or 4 hours, then 4 times a day for the next 2 to 3 days. Protect your skin with a thin cloth. If ice packs are not available, a packet of frozen vegetables in cloth will do. Compression also reduces swelling. Use elastic bandages for at least 2 days. Check that the bandage is snug, but not too tight. Take the bandage off at night. Elevation drains fluids from injured tissues. Elevate the injured area whenever you are sitting or lying down. Try to keep the injured area at or above the level of the heart. To find out if you learned something to our lesson. Answer. Activity 1 titled Name It. Direction. Identify the name of the following materials in the first aid kit. Choose the answer inside the box. The following choices are gloves, scissors, thermometer, safety pins, bandages, tweezers, first aid manual, needle, adhesive tape, antiseptic wipes, triangular bandage. Activity 2. True or false? Direction. Read each statement below carefully. Place a big T on the line if you think a statement is true. Place a big F on the line if you think the statement is false. 1. Don't try to diagnose or treat a broken bone yourself. 2. The importance of first aid is it enables you to assist persons who become injured in the event of an accident until help arrives. 3. A first aider is someone who has lack of knowledge in carrying out a first aid in emergency situation. 4. Self-care measures for an injured knee include RICE. 5. A more severe sprain or strain may require evaluation by a first aider. 6. Rehydration with water or a sports drink is the cornerstone of treatment for heat exhaustion. 7. First aid treatment for heat exhaustion includes recognizing the symptoms, stopping the activity, and moving to a congested environment. 8. Dislocation is most common in shoulders and fingers. 9. Mild sprains can be successfully treated at home. 10. Active compression helps improve blood flow, thereby enhancing the delivery of oxygen to damaged tissue. Knowledge is power. If you learned to our topic for today, for more updates videos, please like, share, and subscribe to our channel. Hello everyone, welcome to our lesson for today. Gaining weight. This can be a result of higher than normal basal metabolic rate or higher physical activity level. This can involve an increase in muscle mass, fat deposits, excess fluids such as water or other factors. When weight gain is a goal, the focus is on gaining muscle and not fat weight. To do this in a healthy way, you should consume more frequent meals with healthy snacks. Losing weight involves a negative energy balance. This can be achieved by increasing exercise and decreasing caloric intake. It can result from a decrease in body fluid, muscle mass, or fat. Determining calorie needs. What is a calorie? A calorie is defined as the heat required to raise the temperature of 1 gram of water 1 degree Celsius. Because this is relatively small amount, scientists use larger unit calories, also called a kilocalorie. The calorie or kilocalorie is 1000 calories. Total energy expenditure or T is the total number of calories your body needs on a daily basis and is determined by the following. Your basal metabolic rate or BMR. The thermic effect of food, also known as dietary-induced thermogenesis. The thermic effect of your physical activity. Basal metabolic rate or BMR is defined as the energy required to maintain your body at rest. Example given, breathing. Circulation. It represents the minimum amount of energy needed to keep your body functioning. To precisely determine your BMR, you would need to fast from 8 to 12 hours and then undergo a laboratory test in which you sit quietly for about 30 minutes while the air you exhale is analyzed. This determines how many calories you are burning at rest. Basal metabolic rate is 60% to 75% of the total energy expenditure. Typically, the larger and more muscular the person is, the higher the BMR is. The thermic effect of food is the energy required to digest and absorb food. The thermic effect is measured in a similar way as BMR, although the measurement time is usually about 4 hours after you consumed a meal. The thermic effect of food is 10% to 15% of your total energy expenditure. The thermic effect of physical activity is the amount of energy required for physical activity. and is the most variable of the three major components of total energy expenditure because it can be as low as 15% for sedentary people and as high as 80% for athletes who train 6 to 8 hours per day. Non-exercise activity thermogenesis or NEAT is an energy expended in unplanned physical activity. This can include taking the stairs instead if the elevator, sitting on a balance ball at your desk, parking farther from your destination in a parking lot, fidgeting, and other calorie-burning activities. Managing your weight. Establishing or maintaining a healthy body weight requires an understanding of how the body uses food to provide energy. In addition, when weight loss is desired, a plan of action is needed for long-term success. Energy balance. Understanding the concept of energy balance (EB) is critical if you want to understand how body weight is regulated in human beings. EB in its simplest form simply compares the amount of energy consumed as food with the amount of energy expended through the combination of resting metabolism, activities of daily living and voluntary physical exercise. The three possible states of EB are positive, negative, and neutral. Positive EB occurs when you consume more energy than you expend, resulting in weight gain. Negative EB occurs when you expend more calories than you consume, resulting in weight loss. Neutral EB occurs when the amount of calories you consume equals the amount that you expend. Estimating calorie needs. Probably the first question that comes to mind when contemplating your own body weight is how many calories do I need? This module includes one simple method of estimating needed calories based on body weight and activity level. An alternative method devised by the U.S. Department of Agriculture or USDA estimates energy needs based in sex, age, and activity level. Calorie levels are based in the Estimated Energy Requirements or EER and activity levels from the Institute of Medicine and Dietary Reference Intakes Macronutrients Report 2002. Sedentary. Less than 30 minutes a day of moderate physical activity in addition to daily activities. Moderately active. At least 30 minutes up to 60 minutes a day of moderate physical activity in addition to daily activities. Active. 60 minutes a day of moderately physical activity in addition to daily activities. Knowledge is power. If you learned to our lesson and for more update videos please like, share and subscribe to my channel.
Good day everyone. Today we will discuss all about sports officiating. Sports officiating is a system of managing a sports, specifically on implementing the game rules and keeping order in the duration of the game. What are the importance of sports officiating? First, officials undertake an important role in the staging of the competitions. Second, they provide leadership and guidance to the participants. Last, ensuring that the competition is conducted in a safe and fair manner. Qualities such as integrity, honesty, trustworthiness, and respect are integral to the role of the official. Qualities of an officiating official. The role of an official is very crucial in a sporting endeavor. He defines the success or failure of a certain physical activity. It is therefore necessary for an aspiring officiating official to possess a number of qualities for him to meet the goal of having a satisfying, complaint-free, impartial, and successful game. The following are some of the qualities to be considered: physical qualities, emotional qualities, mental qualities, and social qualities. Physical qualities. These qualities refer to the physical attributes of an officiating official. Since an officiating official needs to catch up with every detail of what the athletes or player do on court, he needs to have a high level of fitness to be able to perform his job. To determine his level of fitness, he or she has to consider the following. Physical fitness. It is the capacity of an individual to perform his or her daily tasks without undue fatigue and still has the extra energy for recreation and emergencies. Physical fitness is not achieved overnight. One must work on with elevating his own level of fitness if he or she has to perform better in his chosen field of endeavor. Several ways to determine one's fitness, which are basis in improving it, include body mass index, PMHR and THR, or personal maximal heart rate and training heart rate, fitness or exercise program, and last, nutrition and weight management. Emotional qualities. These qualities refer to the emotional readiness of an officiating official to perform his or her role in a game. He or she might have mastered all the roles and possesses a high level of fitness. But if the emotional attributes don't warrant him or her to perform the duties and responsibilities of an officiating official, failure is expected. Emotional attributes that an officiating official should possess include confidence. It is having belief in oneself. Mental qualities. Mental toughness is the term used to refer to all of the qualities pertaining to one's mental preparation in officiating a game. To be mentally tough requires one to stay focused, regulate one's performance, ability to handle pressure, awareness, and control of thoughts and feelings, and one's command and control of the environment. This can be achieved by having a true knowledge on the rules of the game, alertness, vigilance, which result to timely, decisive, honest, and impartial judgment. Social qualities refer to the ability to deal with others at any given situation. Complaints are inevitable in a game. It is the ability of an officiating official to settle these disputes without sacrificing the integrity of a game and the officiating team. To develop such as qualities requires practice, just as the emotional qualities do. Surrounding oneself with people who make wise decisions, especially in officiating endeavors, might help one improve his or her decision-making skills. To know if you learned something to our discussion, answer activity number 1, loop a word. Encircle words that are related to our topic and write the words in the blank. Answer activity number 2, matching type. Match column A with the correct answer on column B. Knowledge is power. Thank you for watching. Please like, share, and subscribe to my channel.